apply it, and then share that with the stakeholder advisory group. And then from there, I believe it goes to, maybe Izzy can speak a little more intelligently about where it goes from the stakeholder advisory group. You're on mute, Izzy.
Sorry. Yes, so the stakeholder advisory group is going to take a first cut at receiving all of the recommendations from all of the work groups next Tuesday. I think there will be numerous times that we'll be talking at that level with it. Also, I think the staff is identifying opportunities to further provide comments, edits, input from the general public, from other key stakeholders that we think are, important constituents and need to be involved. And there are going to be town halls as well in the new year. So we're quite confident that there'll be so many opportunities for people to help us improve upon this document and bring in data, resources, ideas that could help fill the gap or identify where there's overlap or where the recommendations are should be best placed within the entire report. So while we are incredibly pleased with the amount of effort you guys have put in, your work is not done. We invite you to continue to be involved in the process as we go forward. And we, for instance, there were hundreds and hundreds of folks who were not selected to be on stakeholder work groups who were going to go out and solicit them and say, here's what we've done so far. What do you think? So we're going to be coming back to you and inviting your input repeatedly over the next couple of months. So thank you in advance.
So did everyone have a chance to review the changes or the document that was sent out yesterday? And what we thought we could kind of do today is if there were some folks that maybe didn't have a chance to review it, we could talk about or give a high-level overview of each of the sections. But if everybody kind of had a chance to review it, we could maybe talk about whatever feedback folks have, if they notice any overlap, and we want to kind of stay away from the wordsmithing so much, because again, there will be more edits and iterations of this, but really just making sure that it has the content in there, that it encompasses everyone's priority areas and achieves the goals and objectives that we are hoping to tackle. Dan has a question. Raise his hand.
Yeah, I do. Thank you, Tiffany. Thank you, Izzy. And I haven't had a chance to read through the whole thing that you sent yesterday. I read through the part that for the Affording Healthcare, which is the group that I was on, and I think it looks great. Thanks. I think the way you guys put it accurately reflects the conversations that we had in that group. But again, I didn't have a chance to look through the whole thing. So for you, the leaders of the full work group, are there places where you see overlap? I mean, where should we be looking? Is there overlap between these four work groups, or is everything pretty clean and looking good?
So I'm happy to answer that. Where I saw overlap. So there are a couple, and we know that, a lot of these things are connected to each other, right? So healthcare and services is connected to being able to age in place and remain in your home. And so there are some overlaps in mostly in the strategy section. And so I think as we look further and do some of that wordsmithing, and then also compare it to not just this Affording Longevity group, but the other work groups that are out there, I think we're going to see even more overlap, but particularly in the strategy section, because a lot of that is, those are almost like our to-do list, like our task list. And I just think that there by nature is going to be overlap there. But then it's going to be with the stakeholder advisory group and some of the smaller work groups, figuring out how to combine some of those metrics and strategies to make them all work together.
Yeah, that's what I was wondering. Like, what is the step when there is overlap? I mean, we're not going to like. I mean, do you eliminate one and then we can get another strategy? Then we have another strategy that we can use if it's already somewhere else. Do we get a ninth strategy since we're ours is already covered in one other area, or are we just combining them? Or yeah, I'll be interested to see how that works.
Yeah, I will also be interested to see how that works. And I think that's probably going to be something that the stakeholder advisory group discusses and works on together. Like, how do we want to tackle this? We know we don't want a final product with that overlap, but I'm just not sure exactly what's going to be done about it. But I think there is, I know that there will be an effort to combine some things and to make sure that it's concise, but also, adequately addresses all of the items and objectives that we have listed. But I don't know if that like frees up another space. And I don't know, Izzy, do you know, or have you guys talked about that at the staff level? Oh, you're on mute again.
I'm sorry. No, we haven't. And so that's not clear to me, but I do think that Dan, to your question, does that give us more?
That was more of a joke, Izzy. I didn't think that was just a joke.
Okay. Okay.
You're gonna get another strategy in there.
I think I think that the stakeholders advisory group and the LRM staff people who are moving this forward through the next steps are really going to be looking at, did we nail the priorities? Are those the key priorities that we want? Does that and do the strategies really? I mean, I'm sorry. The recommended strategies. Do we nail the goals that we have for, and do the recommended strategies back them up adequately? Right? I'm not using the right language. Recommended objectives that we've identified for each of the 4 areas. Are those the things we stand behind, and do the strategies for those objectives adequately back up what we've identified? And I also think they're going to be looking at, there are whole other work groups that are going to have some things that are related to LTSS or related to housing and healthcare, and they're going to have to kind of weave that together and decide where they're best placed within the report.
Patricia has her hand up.
Yeah, hi everybody. I really appreciate everybody's hard work, and it's certainly been an interesting process. And I'm sorry I missed a meeting of my group so that I could work the polls. But one thing that seems to appear in all of this is better communication with older adults, and there's a thread of that in all of the strategies. So I hope there's a work group that's going to be focusing on that, like education, awareness, access, that sort of thing. Is that recognized as a generalized strategy need?
Oh, I think it's top of mind.
Okay.
From the LRM, right? Because a lot of this does have to do with making sure that people are connected to existing services, being even knowing about it, and
Right.
and communicating that stuff in a way that is useful to them.
Great. Okay. So us repeating it in our strategies is probably just strengthening that commitment.
Yes.
Got it. Okay. I appreciate that very much. Thanks.
On the long-term services and supports framework, at first I was a little concerned that it didn't have like a quantifiable metric in the top line. But then I started looking at some of the strategies that are kind of more about user experience. And I guess this is a question, like, is there a core survey that MDOA plugs into in order to monitor? Because a lot of them are like the customer experience, like wait times or ease of use. And those are valid things to try to improve and enhance, especially for seniors. But like, then how do you quantify that? And so then I was thinking, like, is there already like a like a AARP Maryland survey that is the focal point of analysis of whether people report having a good time with the systems they're using or report long wait times? And if not, might that be something that could be a common thread or recommendation? Because I mean, having like those kind of tentacles to the senior user community would be very important for just overall feedback, system improvements or user experience, or, or to track or monitor progress on some of these domains, right? We would need to have a direct line to the client base. And I don't know if that's something that already exists or something that might be under consideration, but it could be a unifying element that would enhance this process overall.
We do satisfaction surveys at Baltimore County Map, but I guess because so many people's calls are going so many different places, it's hard to track. If somebody's calling each county map office, there's a snapshot there, but they could also be calling 211. They could also be calling AIRS. There's so many, directions that it's going.
Yeah, and I think that's that overarching like communication and gathering of data and analysis, and that's the whole premise of the LRM plan, is to make sure that all of the agencies, counties, cities, areas are collaborating and compiling that information so that they can make an informed progress, for the entire state.
A little more
so-
unity.
Yeah, right, exactly. And I don't know that there's that yet, but Izzy, I see you're off mute. Maybe you have something to add.
I think I'm okay.
You're
can you
off
hear
mute.
me? Okay, yes.
Yes.
No, to Scott's question, Scott, it's really an excellent point, and Carrie's right. I mean, at the local level and various groups like AARP, there are surveys to try and to aggregate that, but a central one, I don't think exists. And we need to do that. And maybe through MAP is probably the best way. If we can understand if there's a standard enough approach, we can aggregate through the maps. I'm just guessing, but it's something that I think we should point out.
It's a place to start.
Yeah.
Ann Johnson?
Yeah, I think in the LTSS group, we had talked about external agencies that could be important in the work of implementing these plans and changes. And for education and awareness, we had talked about MAP and 211 as potential partners with this.
Perfect. Does anybody else have any feedback generally on the document that was sent out? Did anybody else identify some overlap or have any ideas about combining certain strategies or objectives? Oh, you're on mute.
I have a comment. I know there's been a lot of good ideas that's come forward from a lot of the committees and especially the stakeholders of the subgroups. My concern is that information going to be lost in the shuffle? The ideas that we put forth within the wordsmithing and moving to the next group and maybe not capturing all the information, especially from all the experts that we have here, and I would hate for that to be the place that we would end up at.
Yeah, I fully agree with you. And I think that, MDOA staff and those, stakeholder work groups are going to be very mindful of that. So the stakeholder advisory group also has, so I'm on it. I know Dan said Dan is on it, so like there are several of us. So we can pinpoint if we see some other folks saying, oh, I think we should take this out. We know our work group and our subgroup, and we can make sure that those priorities kind of remain there. And then again, like to Izzy's point, these things are going to be coming back down. So they're going to be out for public comment or presented at town halls. And we would encourage everyone to show up to those town halls and to check it out. And if what comes out for public comment is missing something that you feel like got knocked off, from this document, make that comment, let people know, because I think the state is listening to all of that feedback and really doing their best to create something that meets the needs of the older adult population as informed by the older adults themselves and by the experts in the field, which are all of you. Does that sound right, Izzy?
Yeah, absolutely. I totally agree, Carl. That's one of the big goals of organizing this project this way, is to make sure that we are getting a diverse set of direction from all kinds of people who are in the field, who receive services, people who are experts, people who are administrators, just at all levels. That's what we're looking to do. And I can tell you, we've been very deliberate about trying to capture and retain everything that you guys are providing, and hopefully using it in a meaningful way in the end product.
Anybody else have any thoughts or questions? And Carl, does that ease your mind or like answer your question?
That does, and I was glad to see that each particular group had someone there as the staff to sort of capture everything and sort of relay it to the higher levels. That gives me some confidence that it won't be lost in the shuffle. Thank you very much.
Yeah, absolutely. Right. The staff and the public are kind of those that continuity plan, right? So the staff is attending all of these. The staff is attending all the meetings. So thank you guys. But then also making sure that we all show up to those town halls and public meetings and making our voice heard. So did I see another hand go up, or was that Mary Lou? Okay. Oh, you're on mute.
Oh, I was just, my question is, are we going to be notified of any of the public meetings or town halls?
That was my question as well.
Oh, okay.
Well, yes, we've got you in our mailing list now. So,
Okay.
Yes, you'll be aware of those meetings as they're scheduled. Okay.
And is there a time frame? Do you know, Izzy, or are we still kind of working all about stuff out?
It's changing. We at first were thinking that it would be a really good idea to try and schedule them earlier in the year. And now we've come to the conclusion that it probably makes more sense to schedule them a little bit later, after we've got more of a better draft to share and have people responding to that. So the dates have been moved back, and I'm not exactly sure if they're firm yet or not. I think what we want to do is have obviously virtual feedback, but also we're going to have actual in-person meetings around the state so that we can solicit input from all the different regions in the state. And we're trying to set up those locations, I think, now. So, stay tuned.
Anybody else has any comments, questions, thoughts about the process or the document, or edit suggestions? I mean, our hope today was just to kind of, do that one last check-in. We don't have to use the whole hour, but, wanted to do that one last check-in to make sure that everybody feels vested in what we've put together and feels okay knowing, that there will be some edits presenting for Izzy and I presenting this to the stakeholder advisory group next week. So, Mary Lou?
When you have these town halls, are you going to share with the people there what the work groups have suggested and get their opinion on that? Or are you starting square one, asking them what they think?
Yeah, that's a good question. No, we're gonna try and create a product that is a reflection of all of your work
Okay.
as a combined master document, and have people react to that.
Right. So you're starting with the foundation on which to build momentum.
Exactly.
Okay. Good news.
A lot of this is dependent upon the budget. Let's face it, just about everything we've done, it's all about the available funding,
Yes.
for them. And so you don't have any kind of number at all, right? Because we can't put a number on any of it really, because especially the timing.
We don't, but I think that we went into this process understanding that that's a big X factor and it shouldn't be a limiting factor. What we're trying to do is put together a planning document that enlightens people, planners, government officials, everybody to the reality of the changing demographics and the need to plan for the needs of people who are getting older in the state. So we didn't want to, have any limited thinking about, what if we don't have any money, what if the administration changes? We don't want to go there. We want to talk about the future. What do people need to know to plan for 10 years out? And what do you all think we should be doing to get ready for 10 years out?
You had your hand up?
I'm sorry, who'd you call on, Tiffany?
I have Scott and then you, Patricia.
Okay, go Scott.
Okay.
Oh, great. I was just gonna flag the 10% income growth goal. I think we make sure we control for inflation. So inflation is like 2% a year. So over 10 years, inflation would be like 20% or between 20 and 40%. So we need to make sure we say increase incomes by 10% over inflation or in $2,024 or whatever, but there needs to be something else there. Otherwise, that's actually a shrinking of incomes over that 10-year period.
That's a really good point. Yeah, and I think we could put something in there, 10%, adjusting for inflation or something like that to make sure that we are taking that. But good catch. I will make a note of that.
Thanks.
And Patricia?
This is a kind of a weird backwards echo to Denise, but one of the things that we worked on in talking about affording healthcare was keeping people out of the hospital. And just like going to the emergency room is worse than going to your regular doctor, right? Going to the hospital is the very most expensive way that we can care for older adults or get cared for ourselves. So a lot of the stuff that we were talking about would intervene before that. And that's huge potential savings. We could pay for stuff out of some of that money. And I hope that's part of the thinking is keeping people out of nursing homes, which cost $12,000 a month, and letting them stay home with care that might cost us $4,000 a month. Like some of these things have tremendous cost savings built into them. We just end up using the last resort kind of thing because it's the only thing that's there or it's the only thing people know about. So I'm hopeful that some of these ideas actually are revenue neutral or expense neutral.
Yeah, I think that's a great point too. And yes, fingers crossed that, we are able to save by putting some of those things in place and then using that money to enhance our services.
Well, and the best part is it's what people want.
Exactly. Yes. Yeah.
Right? Nobody wants to live in a nursing home. Nobody wants to spend time in the hospital. So if we can do things that catch things earlier or use social determinants of health or nutrition or other things that keep people feeling well or better enough to stay home, that actually also aligns with what our older adults want to do.
And enhances quality of life, so yeah,
No
it's
question.
just, it's win-win for everyone. Dan?
Thanks, Tiffany. And I would just want to kind of echo, Patricia's comments. I think I'm just noticing now, and I think it makes, I understand why it's been done, but I hope it's implied that any savings from these efforts are going to be going into kind of building out the system, and going into support investment in the system. I mean, our work group had recommendation really was decrease preventable hospitalizations by so and so %. And then it continued and reinvest the savings into these strategies and building out a system. That second part has kind of fallen off the objective. And so I just want to make sure that that's kind of implied.
Yes,
Yeah,
yes,
I'm
that's a
looking
great
at-
suggestion.
Oh, wait, go ahead, Izzy, I'm sorry.
I'm sorry. No, I'm just affirming what Dan said.
Yeah. Perfect. Yeah, we will make sure I'm putting a note on it right now. I've got my document up and I'm making little comments and flags to make sure that gets. Ruth?
I know we we're given a timeline, and I know I haven't quite been able to keep up with it, but a couple of tweaks I put, I appreciate the edits and the proofreading and the clarification from the draft that Fran and I put together for folks. And I actually have made a couple of tweaks to that since with input from other folks. And the most important one is the group had come up with the number 15% more seniors being served in the housing subgroup. And I thought it should be a higher number, and my research only showed about like 18 to 20% back of the envelope. So I think the 15% is a pretty good number. And somehow the number got changed to 10% while from the question mark. So if we could go back to 15% increase in services to the seniors, that would be super valuable. And then the document that Fran and I put together has been shared. So if you wanted to look at it again and see if there's anything that can be incorporated, that would be great.
Yeah, I apologize, Ruth. I may have missed that, but are you talking about? Can you tell me exactly what you're talking about in the strategy?
The objective by 2035 increase by blank % the number of older adults. And 15 was the number the group had come up with. And but we had X in there because I thought it should be higher.
Right.
And it got filled in as 10.
Got it.
So it should be 15.
Got it. Okay.
Thank you.
Thanks. Dan?
Um,
were you finished, Ruth? I'm sorry.
Yeah.
Okay, perfect.
I
And
mean,
Dan?
thanks. And thanks, Ruth, for raising that. I mean, likewise, the affording healthcare group really kind of left that blank. We said we wanted to decrease preventable hospitalizations over 10 years by X % over 10 years. I don't think we pulled out the number 10%, just because I think the group really felt that we just didn't have the kind of baseline of what it is now in order to kind of come up with a defensible position, a defensible number without information, and they just haven't had the time to kind of collect that information and do that deep dive. And so again, the number 10% was just added in here. I don't know where they came from or what the rationale for that is, but I just wanted to kind of point that out for good of the group.
I put it in there and I completely made it up.
Okay.
So it was with the notion that we've got to come up with a number that is justifiable, and I need to do some work to do that.
Okay. I get it. I mean, I get the pressure everyone's under, Izzy, and I know we want to have a number out there. I'm just wanted to raise it.
Do you think it should be higher or lower?
Oh, I don't know. I mean, I think it should be 100%. I think we should be reduced preventable hospitalizations by 100%. But I mean, I don't know what's reasonable without having that kind of baseline, kind of data, you know?
Well, it definitely has to be but more than 10 over 10 years. Maybe 10% over 3 years would be reasonable, but 10, that's way too low, without a doubt. And I know because I do insurance, Medicare specifically. So, yeah.
Do folks have a suggested source that I can go to that's comparative?
I mean, maybe, I don't know, the HSCRC might have some data. I mean, they deal with all the hospital kind of hospital issues in the state. I don't know for sure, but it may be worth reaching out to them to see if, kind of explain what we're trying to figure out and see if they have some data that we can point to see trends.
You know, yeah, that's a really good suggestion. I'm sure they've got some goals involved in the planning for the AHEAD model.
Yeah.
Yeah.
Yeah, and if that isn't, you know, if that data isn't easily available, maybe one of the strategies becomes, you know, finding or creating a repository for that sort of data so that we can properly analyze these, the trends and the data and make informed decisions. And that goes not just for this, but for all, you know, I know it's really difficult in the affordable housing side there's no one repository of all of the, you know, affordable housing units. So it's a challenge, and it's kind of like piecemealing data and sort of figuring out what is reasonable. So.
Okay.
Anybody else have some thoughts or questions? Great. And so everybody feels comfortable once we, you know, like kind of just clean things up a little bit. Everybody feels pretty comfortable with Izzy and myself taking this to the stakeholder advisory group next week. Once we, you know, do those little edits and stuff that we have discussed in this session. Ooh, I'm seeing a lot of thumbs up. Yeah.
I do have one addition to, as far as the affordable health care. One of the baselines is the Medicare Part B premium. You know, right now it's at $174.70 for Part B. It is expected to go up. It went up in a year from 100 and basically 65, so it went up like $10. Now the state, the QMB application, you know, the state will pay for Part B premiums, you know, it's all income based, of course. And so that's something that would help if seniors that are on that borderline, because it's a big nut to crack on a fixed income. So when that's taken out of their Social Security, so to raise those limits. So if that goes up at 10% every year, I mean, that's every year just for the premiums. And, you know, and the supplements, if someone has a supplement, you know, they go up the older you get, you know, not every year, but could be every couple of years. So just as far as the affordable health care, the 10% is, I don't know, that's how it's kind of what I'm thinking. That's why I feel like it's so low.
Right. Right. Well, let me do some research and see if I can find something that's that we can base it off of and justify. Okay.
Yep.
And if anybody else has any, you know, data that they can share, or like, you know, or knows of a place where that data is housed, or at least some of it, can point us in the right direction. Of course, I'm sure Izzy would appreciate that as well. Ruth, your hand's up.
Do you still want input on the line items that we kind of never got to? Because we got to objectives and strategies, and then we have a series of questions that were left blank.
Absolutely. I think that the LTSS group actually did go back and reformat their recommendations to move some of the material, the content that they had under strategies, down to the questions that are underneath it. So I think that's what I was hoping to do, is try and fill in based on our existing work. But yeah, Ruth, if you've got suggestions on it, we would like to have it.
Yeah, I'll share it back to you, Izzy and Tiffany, and
Absolutely.
if you so you can decide what to do with it from there. And then the one thing of the things that we did land on as a group that I don't want to get lost in the sauce that I proposed a tweak on is our number one strategy about funding. I filled in some blanks and got some input to wordsmith that a little bit. And so if I can put in the chat where we landed, and it's also in the document that I'll reshare, but I'll put it in the chat so that if other work group members have input, they can see it now before we're gone.
Wonderful. Thank you, Ruth. I think Chelsea Heyman also provided some information and some suggestions regarding the housing one. And I don't believe she's on the call right now, but those are the kinds of things. Please feel free to, if you have some additional things to. Oh.
Yeah, I mean, yeah, I mean, my only comments were just like, it was very minor. I just wanted to capture and ensure that, if there are additional state tax credits created that could benefit older adults and helping them with affording things like accessibility modifications, or like, the statewide independent living tax credit is intended to help offset the cost of installing accessibility modifications into someone's home. So, just to allow for the development of something like that in the future as a potential option for older adult homeowners. So just to broaden it, really, not to like, kind of pick everything apart. But anyway, that's it, really.
Okay.
Thank you.
Yeah. Mm-hmm.
Well, if no one else has any thoughts, suggestions, comments, questions, we could probably let everybody go early, I think, right? We don't want to just hold people here just to hold people here. But again, you know how to get a hold of me or Izzy. And so if something comes up or you find a, snippet of data or information that you think is beneficial to share with us or the group, please feel free to reach out. I not to speak for Izzy, but I'm sure she would appreciate that as well. So
yes, absolutely.
Oh, and Carl, I see you just put your hand up.
Yes, I got a resource that I would like to share with everyone. USA Facts. It's a big database from like all over the country that does like health, economics, and a lot of different things that people may want to use as a resource to help them in their endeavors.
Thank you.
Thank you. It looks like the website is usafacts.org. Right? Does that sound right?
That's correct.
Perfect. Great.
Got it.
Perfect. Anything else? Thoughts, questions, comments? I will drop that link in the chat so everybody has it. Okay. Well, I think we could probably adjourn this meeting. I do want to say it has been a pleasure working with all of you, and I hope as this process continues, and I'll see you guys at the town halls or something, and I'm sure that we will certainly see each other because the aging services industry is relatively small, and I appreciate everything that you guys do here and otherwise, because it really truly is a wonderfully rewarding field. And thank you for everything, and thank you for being such a pleasure to work with.
Thank you. And help me thank Tiffany for sharing this. We got more to do, but we feel like we've made a good start with your efforts. And I know everybody's got other things they could be doing. So we appreciate you volunteering and getting involved. Thank you. All right.
Take care, everyone.